We have a wonderful inside joke, and Lori's great at the delivery, and I'm going to ask her to repeat it because I'm not nearly as good.
Oh,
If you know Pennsylvania Medicaid, you only know Pennsylvania Medicaid.
yes,
So,
yes.
can you say it? Because I love the way you say it. You say it with such energy.
No, I mean, you more or less said it the way I say it. If you know Medicaid and you know Pennsylvania Medicaid, well, you know Pennsylvania Medicaid. There's still 49 states and territories that have their own way of administering Medicaid. And sometimes things are carved in and carved out. And what I mean by that is in some states, for example, there may be pharmacy benefit where if you need a prescription or something like that, where that could be administered by the state instead of by a managed care entity. And so states really can pick and choose how they administer the benefits and what is not covered. And again, you just need to look at your state because I can tell you about certain states, but then you can say, well, I live in, some other state. And I could say, well, I don't know. Another thing that can be carved in or carved out are behavioral health services, mental health services. And another one is long-term services and supports. So those members that really need care, we know will always need care, and they've got a medical or a mental condition that prevents them from trying to go get a full-time job, or maybe they're permanently bedridden, that sort of thing. They're very in a critical care condition. So those services could be carved in or carved out. The other thing that I want to kind of distinguish from is the fact that if the states manage the Medicaid benefit entirely, it is typically called something like fee for service, or it's a direct plan. Whereas if you've got a managed care plan, meaning that you're working with another entity aside from the state to get your health care benefits or your vision, dental, that is typically very different than if the state does all the reimbursement. So all of this is monitored under the federal umbrella of CMS, and that's the Centers for Medicare. I'm going to say Medicaid first, but they will say Medicare and Medicaid services. And when I say that, that also includes Children's Health Insurance Program, or CHIP. So all of that is managed under that federal umbrella, and there are a set of protocols. We have talked about them previously called external quality review, or ECRO, that really kind of governs how things get monitored. And then you start getting into things like program integrity, fraud, waste, and abuse, all of that. But it is subject to these protocols to make sure that, for the most part, even though there is some variance in what is carved in, what's carved out, how the states administer the benefit, but they are governed by those protocols. One other thing that I would be remiss if I didn't mention is that while there are standard protocols, CMS allows states to apply for what they call waivers, where you can try to have additional benefits or additional plan benefits that you offer to your members. And so, examples of that is there is one called a 1915 that's all about managed care. So if a state wants managed care plans to administer their benefits, they have to apply for that waiver. There's a different one that is for home and community-based services. So for example, if you're going to have a visiting nurse or a home health care worker, that's kind of governed like that. Any of the government community programs, if you're going into a community center or you're partnering with an entity, and I'm going to make up one like United Way or Boys and Girls Club of America, those sorts of things, you have to apply for a waiver. And then there's a generic waiver called an 1115 waiver, which is, hey, we have an idea for a program, but it doesn't fit into any of these others, but we'd like to explore it. And some really great programs have been launched through those 1115 waivers. In particular, I think about substance use disorder treatment or early treatment for mothers to make sure they're getting all their prenatal care, those sorts of initiatives. Those can be covered under waivers.